Good morning and welcome to today's webcast, Tracking Provider Relief, COVID-19 Related Expenses and Lost Revenue. As a reminder, the material appearing in this presentation is for informational purposes only and should not be construed as advice of any kind, including, without limitation, legal, accounting, or investment advice. This information is not intended to create, the receipt does not constitute a legal relationship, including but not limited to an accountant-client relationship. Although this information may have been prepared by professionals, it should not be used as a substitute for professional services. If legal, accounting, investment, or other professional advice is required, the services of a professional should be sought. We have a lot of information to share with you today, but we'll try to save some time at the end of the webcast to answer any of your questions. To ask our presenters a question, please type it in the Q&A window and hit submit. If we don't have time to answer your questions, we'll follow up with you after the webcast. Finally, in addition to today's presentation, Moss Adams has many resources to help you navigate COVID-19. You can find links to these resources in the slide deck and handout widget to the left of the slide view, where you also can find today's presentation. With that, I'm pleased to introduce today's presenters from Moss Adams, Tasha Repp, Partner and Tribal and Gaming National Practice Leader, and Lori Laubach, Partner with our Healthcare Consulting Services. With that, I'll turn it over to Tasha to get us started.
Thank you, Pam, and welcome everybody. So today we're going to be talking through a number of funding that our tribal health facilities have received. We're going to talk about some other funding, but the primary focus of this webinar is on HHS's provider relief funding. There's been, I think, a lot of discussion from Tribe and their health facilities on the uses of this funding. There's a number of different ways and methodologies that tribes are currently receiving this funding that I think has created a little bit of confusion. And so we're going to try to bring some clarity to all of the different sources of funding that tribal health facilities are receiving. We're going to talk through, particular to the Provider Relief Fund, the definitions that have been provided for expenses and how you're going to be calculating lost revenues. We're going to talk through some of the compliance and other reporting considerations, and we're going to talk through some of the single audit considerations. But to ensure that we kind of really know who our audience is, and knowing that tribes operate a number of different types of health facilities, programs, and hospitals, we have a survey to ensure that we're kind of addressing all of the issues depending on the different types of facilities you may be representing. So if you're here from a tribal clinic, from a tribal health program, from a IHS hospital, from another health center, or from the tribe or a related business, we would like to know that so we can kind of adjust accordingly as we go through the rest of the webcast today. I think so a fair amount from tribal clinics and tribal health programs, a few health centers, and other, I'm assuming, is a lot of maybe tribal finance, tribal government employees, or I saw there were a few other tribal businesses in the attendees list. So again, the focus of this particular session is really going to be on the health funding that has been received in response to COVID-19. And with that, I will kick it over to Lori.
Yeah, thank you, Tasha. What I'm hoping to do with the next few slides is to walk through various funding options, as Tasha was saying. We've seen multiple acts, kind of an alphabet soup going on with all the different acts that have come into play to try to help relieve our providers. And your health center or hospital, or clinic or health center may have received some of the funds. And ultimately, we want to do is give you some ideas on things on how to use those funds. So within the Family First FCRA, which is one of our alphabet soups, they announced where CDC was designated to administer $80 million to tribes, tribal organizations, and urban Indian organization. It was distributed off of the CDC from CDC, and there was an application on the CDC website. The purpose was to support tribes to prevent, prepare, and respond. You're going to see this as a common theme throughout the entire webcast. But the highest priority response needs were to include like carrying out emergency operations and coordination, trying to get your technology up to date, laboratory capacity, construction or alteration or renovation of non-federally owned facilities to improve preparedness and response capability. And then those reimbursed costs for those purposes incurred on or after January 20th. Now, the important thing about each of these funds is if you look at the date for funds to be applied to these, this one is after January 20th. And then if we go to a different fund, it might be January 1st. Another fund might be another date. So what we've talked to clients about is really tracking what each of the funds they've received and what the purpose was behind that. So there was a notice of application put out there on the CDC website. That is closed, and they've done the funding, and there's actually notification of who received those funds already out there. Then there was provider relief funds that was designated in the CARES Act, and that was passed by Congress and put into place March 27th. What they did was they provided money to Public Health and Social Services, was designated to distribute the provider relief funds. HHS has defined who's eligible for that. They have indicated who's eligible for general versus who's eligible for targeted. Excuse me. To be eligible for general distribution, a provider has to have billed Medicare fee-for-service in 2019. They use that data for their initial tranche, initial set of money that went out. Also has provided or provide diagnosis after January 31st, testing or care for individuals with COVID. So this is, their definition. Then for the targeted, those are where it's actually focusing on special, hot spots, and we'll go through each of those as well. One thing I want to point out that each of the different funds that have been released by HHS, even their first and their second general fund, has a different terms and condition that must be attested to. So make sure you pull it out and look at the terms and conditions and see what the requirements are and make sure that you're comfortable with that. So the first set of funds went to hospitals. I noticed that we didn't have any hospitals that were on the call, but hospitals, but also other healthcare entities. And it was based on 2019 Medicare fee-for-service payments. So when you look at the amount of the CARES Act, which was about $180 billion, then $100 billion was for eligible healthcare providers, and then additional money was provided by the latest act, the PPPHCEA. Here's our alphabet soup, but it came up to about $175 billion that was directly focused on the provider relief fund. This is to be used. All of the funds underneath this relief fund is to prevent, prepare, and respond to COVID. So it's domestically or internationally, which is kind of an interesting comment, but it's also necessary services for making sure that you have healthcare-related expenses or lost revenues that are attributed to the COVID. So in early April, there was some money that was sent out based on the Medicare fees for service payments. Then they realized that they were missing a ton of different providers that were needing money to be able to keep their operations going. So they actually released an additional set of money. One was based on the CMS cost report, and that was mostly received around April 24th. And then there were some additional funds that was received for those individuals who received the initial and the additional funds and wanted to apply for additional funds, or based upon the reporting on June 3rd, they determined that there was additional money that should have been sent out to these individuals based upon the provider portal information that was released. So this money, again, is to be used specifically for those purposes. And then then some additional money came out starting in May. And the first one was for high impact areas. And this is really related to those hospitals who've been, all the hospitals have been actually sending in, inputting their information about the number of COVID admissions that have been occurring. They first put it in from January 1st to April 10th, and they allocated the money to those high impact areas on that date. Then the rural distribution came out, and these are for those entities that are identified on the provider of services file from December 2019 that indicates that they're a rural health center or they're a critical access hospital or federally qualified health center. So this often the tribal health facilities didn't receive this money mainly because of being a grandfathered FQHC. So they weren't on the listing that was on the Medicare provider listing. Some may have received this, and so again, they would need to make sure that money is being used appropriately for the COVID expenses and loss of revenue. They also released on May 29th, and we've heard from some tribes that they've actually continued to receive some money related to this, that there's some funds that were received, about $500 million. This was based upon, again, the December 2019 provider of service file, or the January 17, 2020 HCRIS file and worksheet B off the cost report. So they use those three sources of data to determine which entities would be applicable to receive those funds. And then there actually is currently some funds, if any organization, I didn't see anybody say they were a skilled nursing facility, but there was skilled nursing facilities that received some money on May 22nd. This was if you had a Medicare and they were listed as a Medicare certified facility. So they would have, the best way to know that is whether or not you're listed when you go into Medicare's website and look at the provider service and determine if you have, how many beds you have, and that's how they tied it into that. We had a lot of questions about that because some people had changed the number of beds they had during the period, so they wanted to confirm how they should calculate that. And there'll be a second round of high-impact areas that will occur where they want hospitals to update the number of COVID cases that they've had that have been admitted. And that's supposed to be, there's supposed to be some submissions of that data by June 8th. I'm kind of running through some of this information, but I wanted to make sure that you knew where all the funds were coming with them. HHS actually has updated their website, which had the link on the slide that tells you about each of those funds and how it's calculated. I just summarized it on this slides. Then on June 9th, there was a notification to entities that received Medicaid money and didn't necessarily receive any Medicare money. They may have been a children's hospital or for example, we've seen quite a few dental providers apply for getting money underneath this $15 billion. So this would be where you've had, you're actually listed as a Medicaid provider. It's also, there's money out there for those safety net hospitals, and that's based upon your Medicare disproportionate share reports. So one thing on the Medicaid and Children's Health Insurance Program that's important to know is that it's an application process, and you'll need to get the information and submit that into the government so they can calculate what they should pay to you for your Medicaid population. So you may want to go in as a tribal health facility and look at how much Medicaid that you've received and determine if this applies. Then the other area that's available that came out of the CARES Act and several other acts after that is there's money that was set aside for uninsured patients. One of the items that is in the terms and conditions is that you're not to balance bill patients, or if you agree to the terms and conditions that you will not bill uninsured patients, but there is a fund available to that. But you have to be uninsured and not eligible for other funds. So if the patient's eligible for IHS funds, then they would not be able to be submitted through this. Some weirdness about this one is that it goes against a lot of coding guidelines. They want you to put the diagnosis code for COVID as the primary when that's not normally the reason that you're treating them. And it's a significant amount of money that's been set aside for this. So we'll see how this works through, but it's administered through United Health Group through HRSA. So Tasha, do you want to talk about this, the CARES Act, the CRF?
Yeah. So although the CRF fund isn't, directly being provided to tribal health facilities, it is clearly a source of funding that's getting a lot of discussion right now. I had two emails this morning from clients that said that there was an additional distribution of funds that actually got deposited last night as a result of some of the court filings that occurred that indicated that Treasury wasn't allowed to kind of hold back some funds that they were holding back. And so for most tribes, you should have received probably 3 payments and deposits from Treasury at this point for this coronavirus relief fund, which was in Title V of the CARES Act. So again, I'm not going to spend a ton of time talking about this because this isn't specifically related to tribal health facilities, but it can be used to support tribal health facilities. So I thought it was good to just spend a couple of minutes talking about this funding. So there was, again, an $8 billion set aside of this funds for Indian tribes and their businesses. And it is intended to cover costs that are necessary to respond to the public health emergency. There are some limiting factors as to what these funds could be used for. It's for costs incurred between March 1st and December 30th. I know that's not a typo. It really is December 30th. It is not intended to cover costs that were previously budgeted. There's a lot of questions that have come up as to what that means. In the guidelines, it talks about you might have exceptions to those costs that had previously been budgeted if they're no longer legally be able to be funded from that original budget source, or if the costs or the are now being incurred for a substantially different use. So a good example of that would be maybe for tribal law enforcement, because public safety costs are an eligible activity under this program, where how your law enforcement officers, what they're doing day to day is different, a substantially different kind of use or purpose than what they had been originally budgeted to do when your budgets were established. It does clarify that costs cannot be used to fill shortfalls in government revenue. So again, different than this provider relief fund that we're going to talk about, where there is some opportunity for looking at lost revenues. Costs are primarily intended to be used for, those things that were responding to the public health emergency, such as public health and public safety. And in the guidelines, and really more in the FAQs that Treasury has issued on this, they do give a lot of deference to the public health costs. So if your health facility is still struggling to kind of meet the needs of your citizens, there's, likely part of the conversation your tribal councils or governing bodies are having at this point is, whether there are funds available under this coronavirus relief fund to provide some additional funding to your health facilities to enhance your public health efforts. Clearly, that is not the only use of these funds. These funds are also allowed to be used for the secondary effects of the emergency. So the secondary effects are really looking more at how businesses have been impacted due to stay-at-home orders, or how individuals have been impacted as a result of business closures. So there's lots of opportunities to provide grants to businesses. There's a lot of conversation going on right now about providing direct assistance to tribal members. We have created a flow chart that will help tribal councils kind of navigate what the guidelines say about how to use those funds. If you're interested in obtaining that flow chart, we're happy to share that with you. We've got a lot of additional resources on the Coronavirus Relief Fund for our tribal clients. And if you've got questions, please feel free to reach out. I'm not going to talk much further about that particular fund until we get to a little bit of the single audit discussion. But it is, because it can be used for public health, thought it was appropriate to spend a few minutes talking about it during this session. You know, there were clearly other funding opportunities available through the CARES Act and through the CARES kind of 3.5. And one of those was the Paycheck Protection Program. So there was, again, $310 billion with $60 billion exclusively for small lenders and community financial institutions, because, again, the PPP loan program, you would work with your financial institutions to obtain those loans. I do know we have a few tribes that obtained PPP loans for some health-related activities. Some considered using those for dental offices that were closed and kind of trying to address the payments to the employees at those dental facilities. I have a few that operate kind of more for-profit type health facilities that obtain PPP funding for some of those employees. There are a number of, I think, opportunities. At this point, though, you know, the PPP loan program has mostly been fully distributed at this point. So you might still be able to talk to your financial institutions to see if there are any of those loan program funds still available. One of the important things to note about this program is that in the original guidelines that were issued, there were some restrictions on how much money had to be spent on payroll versus rent or other costs, and how quickly you had to kind of re-employ and get everybody at your facilities back to work. There was revised legislation that was issued here recently in the last couple of weeks that changed the terms for that program, that allows a longer period of time to bring all of your employees back to full employment, and some other changes. So if you had evaluated the PPP program early on and kind of decided it didn't fit kind of what you were going to be able to do, or that it was going to best meet the needs, you may want to relook at that, given that they did significantly kind of revise how the program is structured and provide some more flexibility with that program. Another kind of loan program that is available, again, both of these through the Small Business Administration, is the Economic Injury Disaster Loan Program. There was $50 billion and an additional $10 billion for the Emergency Idle Grant Program. Tribal businesses were also eligible for this. Both of these are for tribal businesses that had fewer than 500 employees. The Economic Injury Disaster Loan Program, not quite, I think, as much discussion on that program, primarily because the PPP program, you've got an opportunity to convert that to a grant and have the loan forgiven. The EIDL program does not have that same feature of forgiving the entire loan, but there is a $10,000 amount that does not have to be repaid with that program. Lori, do you want to talk about the couple of other funding items that were in the Act?
Yeah, definitely. There was some additional money that was set aside to assist organization for testing and research, which includes development, manufacturing, purchasing, and then support for workforce, as well as expanding, in order to expand for COVID tests. Some is available for employers as well as tribes. So, for example, there's about $11 billion of the $25 billion, there's a lot of numbers running around, that was available to states, local localities, territories, and tribes to do that in process, as well as scale up laboratory capacity, trace contacts, and support employer testing. I think it's in order to get this money, they're doing an evaluation of the organizations and how much testing is going on. And then there's $750 million that was pegged for tribes, tribal organizations, and urban Indian organizations in conjunction with they're going to do that with IHS. So there may be some money coming from that toward tribes. There was, on the fourth bullet, we did talk about, COVID-19 testing. There's another $25 billion on there. There's missing a 2. It's $225 billion that was set aside for COVID testing, new funding streams, which kind of basically sets out minimum funding levels for states and local governments. So far, these funds are being used for like building or construction of temporary structures, leasing of properties, or even retrofitting of facilities as necessary to support that COVID testing. So it's around the testing. It's not to be used for, the other expenses. It's really focused on the testing component of that. And it's going to be distributed through the Provider Relief Fund as well. I haven't seen the alert saying when that information is coming out, but I've seen that this is separate from the funding that you might have received from HRSA. Then when we go to the what we call downstream distributions of funds, there was money that was trickled down from other agencies such as HRSA. And when we look at the different funds that we have a CFDA number on, health centers received 3 sets of funds in addition to what Tasha already talked about. But there was what we called H8C, which is for prevention to reduce the risk of COVID, prepare, respond, as well as maintain and increase capacity. So I set aside how it was calculated, and when that money was received, there was an immediate need to go in and report certain expenses and attest to it and say that you received it. The same thing happened with H8AD, which actually talks about it's for the safety, response, and capacity. And I link that, say those out loud because I want to make sure that we know the purposes of each of the funds so that when we go to prepare the expenses and related support for it, that we know what was used and where we're going to be using it into which grant or into which award. So, but 8D only is different from the prior fund because it does allow for minor changes to your facilities and mobile units. Whereas the HAE, I mean, everybody's probably going crazy with all my numbering and et cetera, but the purpose of this funding is to purchase, administer, and expand capacity for testing to monitor and suppress COVID. So it's they haven't specifically said this is how you have to do the testing, but they talk about a wide range of testing and testing related in-scope activities. So, there's definitely different purposes for each of these funds. So that's important to track, and I know that you can go out, and if you said, I don't know if I received those funds, you can actually go out to the grant database on HRSA and look up, what are the dollars and by which of those CFDAs. It's also interesting is that we talked about the $225 on the prior page, but there's nearly $50,000 per rural health center that's going to be dispersed as well for COVID-related testing and expenses. So, Tasha, any other items on this one before we go to a polling question?
Nope, I don't think so.
Oops, I went too far. Oops.
Oh. I think we both hit it.
We both hit it at the same time. We didn't practice. Yep, go ahead.
There we go. So, because these provider relief funds were coming through a number of different forms and payments and set-asides, we're, wanting to make sure we're, again, understanding, how many tribal clients are receiving this. Clearly, I know we had several who had logged on and applied for some of the earlier fundings that Lori talked through, but that not every tribal health facility received those funds. We know some in that very first payment that got a direct deposit of these provider relief funds. And then clearly we have started to see that several of our clients have received money through that $500 million IHS set aside. What I have seen so far is that primarily was coming through as a check, and it came with some terms and conditions some other information on those awards. So I'm hopeful that we'll see that a lot of people are aware that they have started to receive some of this provider relief funds. But we'll look at the survey here in a second and see if I'm right. So yes, 60% of the attendees have received some form of these provider relief fund distributions. I would guess the big portion of NA is maybe from that other bucket. I know we've got a few people here on the call that are from other tribal businesses who presumably would not have received money under the provider relief fund. So that is in line with my expectations that we're starting to see that a lot of the tribal health facilities have received this funding. All right, Lori, back to you.
Yeah, thank you. So now we're going to dig into, as we went through the different funds, I didn't spend a lot of time talking through what is the definitions that's out there. And so what we thought we'd do now is talk through what is an expense and what is a lost revenue related to the provider relief funds. This is not going to cover anything related to PPP because they have different definitions and different ways of tracking. But key here is if we go to definition, it's basically healthcare-related expenses attributed to coronavirus. So we've talked about that before. That's what it's supposed to be for: prevent, prepare for, and respond to it. But it must be incurred on any date as long as it can be incurred on any day as long as attributable to COVID. So what does that mean? So according to recent FAQ from HHS, they have provided that the expenses could have started in January 1st, January 1st, if you were already starting to talk about how you're going to deal with the COVID pandemic that might be coming your way, and you've had meetings to kind of strategize and look at that, started purchasing some items ahead of time. And what I've recommended a lot of people, if we're going way back before that, the actual emergency was called, or even some of the dates that are in some of the documents, is to make sure you have documentation, may it be meeting minutes, or you have information where you prepared a purchase order and you said, this was for additional PPE, or let's start thinking about the equipment we need to put in place, because I know some organizations actually started to think about, do I get a 3D printer to start helping with some of the stuff that I can't get because we're rural, that type of thing. So step back and really figure out how, if you did go that, and as well as any type of expenses after that. We're going to talk a little bit about documentation as well. So some of the areas they provided in the FAQs as well, and this one is from June 2nd, they did provide some examples of what you could be tracking for expenses related to the provider relief. When you look at the HRSA has some great slides on what to use and not use the fund, what is not good example use of funds and what is. But they do talk about things, and we've suggest to clients to sit down with your operations folks and say, what did we do to prepare for this? I mean, you may already be sitting down with them on a regular basis, but maybe brainstorming about where those costs might have come through. So when we've done that with clients, they've actually come up with some additional ideas, did a whiteboard kind of looking at the cost and trying to say, okay, this we can get is a direct expense, and going through that. And Tasha will touch on some of the single audit requirements. But they talk about any type of patient or community education and that you might have done, screening lab services that you might have had, or if you set up something for testing or walk-up testing that you're helping your patients with, determining if they have COVID. Also, any contracting personnel. So when I talk to clients, I say, if you had had to bring somebody in because you needed to have some oversight over and above what you currently have because of volume or, that type of thing. So example, a medical director that needed to meet, you needed them to do additional work, but your current provider is so busy, that is your medical director, so you brought somebody in to do oversight. Or the example might be is you have contracted services for those individuals that filled in where you didn't have your staff show up or were unable to come in because of their own problems with COVID. But you also want to one thing I've noticed a lot of people aren't thinking about is the training that you gave your employees on how to work with the patient, how to determine that the patient has COVID, or might have signs of it. Those type of training things that were given during the onset of this would be important to the cost of what it took to get the training together, and then the time. But it's also about thinking about supplies. A lot of people think I can just do all PPE, and I said, no, you got to look at what you always get for PPE, and anything above that to actually, you can some of the costs that might be you could use here is non-fixed barriers to separate patients. You had to separate them out, or you had to get new equipment or transport patients or personnel because of that was needed to move patients around. And then don't forget about your technology. There's you can put the funding through here for any technologies to expand or preserve delivery of care, but it's also that communication for any telehealth. There are other grants as well available, like FCC has, you can apply for money to cover any telehealth, technology, that type of thing. And there are some local state grants that we've been finding for various clients. And as I mentioned, under H8D, you can cost out minor alteration and renovation and mobile medical units. But they will not allow you to include costs for an electronic health record that's not certified by ONC, or any new construction, or any activities outside your health center program scope, or do not support the funding purposes. So that's a lot on expenses, but it's kind of a way to start brainstorming about what you might be able to use this money for. The other part of provider relief is that you can actually track lost revenues that are attributable to COVID. So this would be any revenue that you lost during COVID. So it could be as related to potentially the loss of revenue during the dental unit being closed, or restrictions on your behavioral health units. But it's associated with fewer patient visits, canceled procedures, or increased uncompensated care. They can also cover some of the expenses related to the employees as well. So, it's looking at those expenses related to those facilities, like your dental, I keep picking on dental, but it could be your dental facility. But what are those expenses? So what they've provided is, if you do have lost revenue that you had to, because you had to maintain certain delivery capacity, then what they recommend is for you to look within your lost revenue calculations at certain things like that employee or contractor payroll related to. Now, I'm going to bring up the fact that if you're getting a PPP loan and do loan forgiveness, you can't double count it, which is pretty straightforward, but just making sure that we talked about the fact that you can take expenses related to the employees for those areas where you couldn't see patients, or there was a reduced number of patients, and actually track the expenses related to it as well. And they give some examples here. So what we've been recommending to clients is sit down and really say, where did we lose the revenue? Did we keep employees in place? If we didn't do anything with PPP, then we go ahead and track those expenses as well. Any additions, Tasha, before we move on?
No, I just think, this is kind of a new concept, and this is an area where we are clearly getting a lot of questions about this lost revenue stuff. So I think it's good to spend some time talking on it.
Yeah,
and I think I was just going to say, I think part of that confusion is also because in other funding available to tribes, right, that coronavirus relief fund, it specifically says you cannot use that money to subsidize programs for lost revenue. Again, making sure you understand all of the kind of ins and outs and details of all of these programs. I know it's complicated, but it's important because they do vary a lot from funding source to funding source, even though they're all kind of CARES Act funding that's coming through.
Definitely. Yeah, and I've seen some clients that have sat down and just, looked at volume between, what they had budgeted for to what they actually had the prior year, and said, okay, would we have had the same volume? And got down to pretty detailed analysis related to this, and it's all done in incredible spreadsheets to support, later on if somebody has any questions. So moving on to compliance and reporting considerations, one of the things that I I've talked about a couple times is you just can't, there's no double dipping between the different funding sources. So having a good analysis that says, okay, we use this over on ABC, PPP, or we use it on et cetera, then we need to make sure that we don't also use it on the provider relief funds. The attestation, there is a requirement upon the receipt of the funds, you're to go into HHS's website and you're to attest that you received the funds and that you will use it according to the terms and conditions. The terms and conditions from each of the provider release funds has just a little bit of a difference to it. So make sure you read it, understand it. The first section's pretty similar, but then when it goes into more details. And one of the items on there is that you will be reporting quarterly. 10 days after the end of the quarter, you'll report what you've used the funds for so far. So that deadline for anybody who's received funds before June 30th, that deadline's coming up pretty darn quick. So what's going to happen is that they're going to be sending out some reporting requirements. I would have thought I've seen them at this point, but they're trying to fast and furiously put things together. They're going to create probably another portal, a reporting portal like they've done for the attestation that you've done for there was some, United has, a portal. The reporting the hospital counts, those have all been done through some type of portal that they've set up. So keep an eye out for that, and we'll keep letting people know about if we've seen something out on the website about it and when it's going to be available. You also have a requirement in terms of conditions that you will not do balance billing of the patients, so you won't try to recoup it from them, particularly if you're accepting an uninsured patient. There is some discussion about whether or not if you attest to those terms and conditions and you don't read them and you don't abide by the conditions, which means the reporting, the use of the funds, there could be potentially falls underneath a false claim, but really right now they're saying honest errors will not generate a false claim. But just make sure that whatever estimates you're using or information that you're reporting has, you keep a workbook, or so I call it work papers because, we come from an accounting world. And I just want to mention one thing on the reporting. That reporting is only for those folks who have received provider release from HHS that's greater than $150,000. That means cumulative, so I'm sorry I didn't mention that on the reporting. The other thing is that there are, one of the things have come up with several of the things is if you've put into place telehealth, there's been a lot of coding and medical documentation and billing issues, and making sure that you properly submit that. Of course, the government comes out with new changes like on a regular basis, but really making sure that you're keeping track of those. But one thing I want to mention on this slide before I move on is that as you start to put your documentation together, and that just takes me to the next slide, but you want to think about keeping that documentation for 6 years potentially. So if you go back to when we had, the bank issues and, there was the funding of individuals, it took them almost 12 years to actually prosecute and go through and do audits of different organizations. I'm not saying you need to keep your information for 12 years. I'm just saying that you want to make sure that we keep that documentation of how we made our decisions, what information we used from HHS or HRSA's website about what expenses or loss of revenue calculations should be done. So keep that information in a file electronically, hopefully, that you can pull back out again if the government sends you a request for how you determine that. We've also been recommending that if you go onto the HHS website or HRSA and there is some guidance that you relied on, I would highly recommend that you print it that day that you use it with, and that has a date on it, because their information's changing hourly, and I go out to the website and I'll look for a FAQ that was provided in April. It's no longer there. It's been removed and they've replaced it with a new FAQ response. So it's important to keep that information just to maintain it and say this is how we determined the relief fund usage. So from that, I'm going to move it to our next polling question. And the next polling question is, which is the most following is critical to document? So is it payments such as loans, amount, date, received, grant, or name? Reporting requirements for each loan or grant, tracking of expenses related to COVID, or tracking of disbursements to ensure no duplication, or all of the above. And so, going back to documentation, it's something that, we have been helping clients look at, determine if it makes sense, even strategizing with them, thinking through what would be the risk of including certain funds or not including certain things, and going through that with them. With that, let's see what have as responses. Well, everybody answered it correct. Everybody gets an A. You can all go home with a happy face. So I'm going to turn this over now to Tasha.
Thanks, Lori. So I'm going to talk a little bit about some of the single audit considerations and kind of some additional kind of compliance considerations related to kind of broadly some of the funding that the tribe is receiving, and then more specifically on this provider relief fund. So, again, there's a lot of new funding that tribes are receiving, and what we've seen so far is that most of this new funding that's coming from, all of this different COVID response legislation from the federal government, they are creating as new programs and assigning new CFDA numbers to those programs. So I've got a list here, provider relief funds, 93,448, the emergency grants to address mental health and substance abuse disorders that I know a couple of my clients had received, the coronavirus relief funds, which is that big funding from Treasury. And so we're starting to get more information on how these might impact a tribe or a tribal health facility's single audit. So I guess one thing, because they're assigning separate CFDA numbers to most of these programs, one of the questions that we've gotten is, do we need to separately track these? And the answer is definitely yes, right? As Lori's kind of indicated, all of these different funding amounts that tribes are receiving have slightly different nuances in how they can be used, what might require to be recorded, what the terms and conditions are. And so we're suggesting that, everybody, kind of treat these like you're doing any of your other grants where you're creating a separate fund or program within your accounting system to really separately track what's getting charged against them. And that helps you in ensuring, again, as Lori indicated earlier, that you're not double dipping in some circumstances, right? If you've got a separate fund to track it, that's a little easier to help substantiate exactly what you spent those funds on. One of the things that I do want to point out here is that if you did get one of those EIDL loans through the Small Business Administration, those are subject to single audit. There is a CFDA number associated with that loan program. And loans are something that do belong on the schedule of expenditures of federal awards. We don't see them as often as kind of direct grant and expenditure funding, but there is a requirement for reporting loans on that as well. PPP loans, however, are believed not to be subject to single audit. We haven't seen any official documentation from the Small Business Administration on this that I can point anyone to, but we do know that the AICPA had conversations with the Small Business Administration and sent a message out to all government auditors that they interact with to indicate that the SBA has at least verbally indicated that those PPP loans are not going to be subject to single audit. Clearly, if your loan program that you had was over $2 million, there are some other audit requirements about auditing potentially the eligibility for how you obtained the loan, but separate from single audit. And again, because some of this provider relief fund and the coronavirus relief fund, it's not taking the form of a traditional kind of grant award. And at least on the coronavirus relief and Lori, correct me if I'm wrong on the provider relief fund, they have concluded that these are federal financial assistance, even though they're not taking the form of a grant. So again, I've indicated they've assigned a CFDA number. They've indicated these programs are going to be subject to single audit. So one of the questions we were getting a lot was, are they going to be subject to the uniform guidance? And the guidelines that have been issued so far, and again, we have seen changes, as Lori's kind of talked about on that last slide. One day we'll look at kind of the website that says what's applicable, and then 3 days later, we'll look at it again and it might be slightly different. So this is based on what we know today, which I think is true of a lot of these programs. We're going to continue to get additional guidance and information. But right now, what they are indicating is for the provider relief funds, most of the uniform guidance does apply. So the sections on post-federal award requirements, which includes kind of the procurement and equipment and real property requirements applies. The allowable cost principles applies, and clearly the audit requirements apply. For the coronavirus relief funds from Treasury, just to clarify, they have so far indicated that the uniform guidance only applies in part. So there's only 3 sections of the uniform guidance that they've indicated today will apply to that coronavirus relief fund. Internal controls, right? So just making sure that you've got controls over how you're determining that the costs charged to the fund are allowable. But they did also include subrecipient monitoring, and I think that's important to point out that if the tribe is receiving that money from Treasury and then passing through that money to either, their standalone tribal health facility or to potentially a tribal business, that could subject those entities to single audit, which could be new. But also that if the tribe is passing through monies to, kind of their other entities and businesses, that there's potentially some subrecipient monitoring activities that you will also want to make sure you're complying with as you're kind of developing those grants or programs to provide money to your other entities. As is always important with all of the other grants and funding, trying to stay on top of and read the terms and conditions of the grant award agreements. Again, these aren't taking the form of kind of traditional funding that we're seeing. And so I think we've had a few people who've kind of read through the terms and conditions and saw something new that wasn't typical that they typically saw in, grant award agreements that they're obtaining from HHS. Again, I think on the reporting side, Lori touched on this a little bit about, kind of the expectation about what's going to have to be reported at an interim basis, presumably a quarterly basis. We're still waiting for detailed reporting guidance on a lot of these. But what we've seen in kind of other programs that were funded under, this CARES Act and other related federal funding is they're taking a similar approach to what they did with the Recovery Act. So we are expecting to see some similarities in that, but again, we will send out alerts as soon as we see when any of the actual reporting requirements are issued. One thing on the allowable cost kind of uniform guidance considerations that we're also getting a lot of questions on is whether you're allowed to charge indirect to these programs. And right now, kind of universally, the answer appears to be not yet. They do allow in several of these for certain provisions to clearly allow for certain administrative and overhead type costs, but they don't go so far as to say that indirect is allowed. We're hoping that they might kind of revise that stance, but for the moment, it seems like actually charging just kind of your overall indirect cost rate may not be allowed, but is definitely something that you may want to be digging into further to understand, or there may be opportunities in future funding. I know they're talking about trying to ensure that that's made more clear that indirect should have been allowed for these funds. Some other potential audit considerations is right now, I know a lot of people are asking us as the external auditors that are going to be auditing your compliance with these programs, since they're going to be subject to single audit, and having us weigh in on kind of whether something is allowable. And you know, today we're pretty much in the same position that you are. The information that you have is the same information that we have as to, you know, what actual guidelines have been issued, what FAQs have been issued. There typically is specific audit guidance that the federal government, that the Office of Management and Budget issues on an annual basis to kind of tell auditors what they're going to audit relative to most of the kind of large programs. So for example, your Indian Health Service, self-governance funding, they issue annual guidance to external auditors to kind of tell us what they want us to audit for that program. And they issue that guidance on an annual basis. Normally, that guidance would have already been issued. They typically try to issue it somewhere in the April, May, June timeframe. Clearly, with the onset of all of this additional funding under the CARES Act, the issuance of that guidance has been delayed. So what we've heard most recently from the Office of Management and Budget is that they're probably going to issue 2 sets of guidance this year for auditors in how to audit 2020 single audit programs. And the first set of guidance we're expecting, hopefully here, I heard by the end of June, fingers crossed, will be kind of their normal annual update, but it's not going to include much, if any, information on these specific CARES Act programs. Their plan is to issue an additional audit guidance or supplemental guidance to auditors on CARES Act related programs, but that guidance is not expected to get issued until September or October. So again, that'll be something that you're going to want to talk to your auditors about, or will be helpful for you to know what specific things they're going to ask us as the external auditor to audit as it relates to compliance with these programs. If I had to guess, you know, it will be the things that we're typically looking at. What I'm not sure about is whether they will have a lot of special terms and conditions, which they sometimes do for us as auditors, or special tests. So clearly I expect that a big focus of this is going to be on the allowable activities, right? A lot of what is unique about this funding that tribes are receiving is the specific restrictions on how you can use these funds. So I would expect that is something that is likely to be in there. I would expect some of the reporting information is likely to get in there. What else might be in there is a little bit of a question mark, and we'll kind of have to wait and see. But I think the other thing to kind of recognize about all of this CARES Act funding is that these programs are going to have a higher likelihood of being selected for audit testing for your 2020 audit year. You know, some of these programs are quite large, which makes them more likely to be selected for testing. But auditors also have to do a risk assessment and how they select programs each year to test for single audit purposes. And, you know, that risk assessment kind of includes things like understanding, are these a new program? So again, I indicated they've created a lot of new CFDA numbers. One of the requirements for auditors is if a CFDA number has not been previously audited in the last 2 years and it's over a certain dollar amount, you know, those are automatically required to be tested. So a lot of this funding is going to fall into that automatic bucket. But there's even the smaller programs we have to do a risk assessment on. And part of that risk assessment includes, you know, is it new to you as a recipient? Is it new to the federal agency? Is there a lot of clear guidance that's been issued? And clearly, you know, with the complexity of these programs and kind of the changing regulatory guidance, I would expect that a lot of auditors will kind of consider these programs to be higher risk. Now, if you reckon back to the Recovery Act period, at that time, the federal government told all auditors that all Recovery Act money was required to be high risk. The federal government has not issued that guidance yet, but again, we're really not expecting a lot of clarification from the federal government on kind of the audit side of this until September or October, so more to come there. So again, hopefully we covered today kind of the highlights on your questions about the use of the provider relief funds. Clearly there's going to be additional considerations and guidance to come. I do, since we're at the 11 o'clock hour, Lori, want to see if we had any questions that we felt like were worth going over on the webinar. For those of you that submitted other questions that we haven't yet answered as part of this webinar, we will do direct follow-up afterwards. So Lori, was there anything that you wanted to do from a Q&A standpoint?
The only question on here that I thought maybe you could answer just quickly is about a procurement requirement for Treasury and PRF funds. I know you can answer that in a heartbeat, so.
Yeah, so the provider relief funds, so the section of the uniform guidance that covers procurement is on that post-award requirements is where the procurement guidance stands, and that section of the uniform guidance is applicable to the provider relief funds. For the coronavirus relief funds from Treasury, that section of the uniform guidance is not applicable. However, I would presume that the tribe has a procurement policy or the health facility has a procurement policy, and there is still an expectation that you are going to be meeting your own internal policies. I think what we are hearing a lot about as it relates to procurement is how much of the activities that are occurring today would meet kind of the sole source justifications for, do we really have to take the time to kind of bid this out? And I think there is a lot of this that likely due to the public health emergency and the exigency that's involved with obtaining, PPE or other things, that there is a high likelihood that there's more things that will fit into that sole source justification bucket.
Great. No, I have nothing else, so.
All right. So as Pam indicated at the beginning of the call, you can download these slides. There's links to a lot of additional resources that Moss Adams has provided, other webcasts that we've provided. We will continue to do lots of information on this as we learn more about these programs. It feels like each and every day. And with that, the contact information for myself and for Lori is here. Please feel free to reach out afterwards after you've had time to absorb all of this information. If you've got follow-up calls or questions, we're happy to answer those as well. And Pam, anything else?
No, I think just wanted to say thank you, Tasha and Lori, for a great presentation today. Here is a link to a survey where you can provide feedback for today's presentation. Please take a moment to complete this survey as your feedback is very important to us. And yeah, thank you all again for joining us, and we hope you'll join us again next time.
Thank you, everyone.